The most common phrase I hear is pregnant women saying, I don't want to tear. If this is you, this is a video just for you, because we're going to talk about perineal massage, how to do it, the steps, when not to. Keep watching. If you're new here, make sure that you subscribe. My name's Heather Marr, and I'm a pelvic floor physical therapist. I'm passionate about helping women move from fear, confusion, and pain to relief, confidence, and freedom. Today, we're talking about preparing the pelvic floor for delivery. So what can you do? Because again, approximately 65% of women have some perineal trauma to the pelvic floor. I'm not saying this so that you're scared, but you're aware. When we connect to the pelvic floor, we go in more confidently and we can do better. We can control some aspects of deliveries, not everything, but these are some things that you can do. Let's talk about perineal massage, but first let's talk about the anatomy so you can connect to the pelvic floor. So this is a pelvic floor. This is a pelvic girdle. If you're looking at this from the top, this is a pelvic clock. 12 o'clock's up, 6 o'clock's down, 3 and 9. So that's easy orientation here. As we're looking at this area, we're talking about the clitoris, the urethra, where the urine comes out, the vaginal opening, and the perineal body, which is really important here, and the anus. As you can see, a lot of muscles attached to this perineum, or this perineal body. This is between the vaginal opening and the anus. When women deliver vaginally, these tissues stretch up to 3 times their normal length, which is pretty amazing. Our body is really resilient. But what can we do to prepare the pelvic floor for this stretching? One thing is perineal massage. When do you do perineal massage? We do it with doctor's approval at 34 to 35 weeks. And you do not do it if you have placenta previa, active bleeding, or of an active infection. Again, you want to start with your doctor to get the doctor's approval. Then at 34 or 35 weeks, we begin. How often do we do it? 1 or 2 times a week for about 5 minutes. There have been some studies that have actually shown that doing it more frequently, women are really zealous. I'm like, I'm going to take care of this. It actually doesn't increase the benefit. So the perineal massage is important to do at 34, 35 weeks to prepare the tissues. Why do this? Again, to allow some elasticity to the pelvic floor, preparing it. Also, if you have an epidural and you can't feel down here, but you've been doing perineal massage, you know how that stretches and you know how to lengthen. It's connecting to that pelvic floor. So let's jump back into how to do this. You want to get into a comfortable position. That's why I'm sitting here on the bed. Prop yourself up, bend your knees. I'm going to pretend that this is my pelvic floor, and it might be hard for you to get into this position. So you might want to have a partner or husband help you out. Again, getting to this part, bringing both hands around. You can use 1 hand or 2 hands, and you want to insert vaginally and stretch. It's a U stretch, almost going into just up to a little bit inside the vaginal opening. I like to use my sleeve here as an example. I just insert my finger and just stretch from one side to the other. You can use 2 fingers as well as stretching, or just 1. Again, the keys are a gentle stretch. It might be uncomfortable at first, but it gets more comfortable with repetition and stretching. Another thing is you want to breathe through it. So if you find yourself tensing up, go back to your smell the roses, blow out the candles, relaxation. You want to lengthen. You want to work with this. So again, it takes communication if you're working with somebody else. And some other key things are, remember to cut your fingernails, wash your hands, and use a lubricant, such as slippery stuff that's available on Amazon or coconut oil. You just want a little bit of lubrication there. So again, we're doing this to prepare the pelvic floor. And again, you'll feel a little bit of tension. You're like, oh yeah, I know that. I will relax. I will blossom my pelvic floor. Again, why are we doing this? To prevent some tearing. There's tears that occur in delivery, and they're graded 1, 2, 3, and 4. Again, a grade 1 tear is just the perineal tissues. It can be repaired with 0 to 1 stitches, actually. A grade 2 can go into this perineal body, into the perineal muscles here. I had 2 grade 2 tears myself, and there were several stitches that were put in. Recovery was pretty simple. If we go into a grade 3 or 4, it goes farther, closer to the anus here. The risk for bowel incontinence is greater, and it sometimes requires more of a surgical repair. Again, not to scare you, but to allow you to understand what's going on and to do everything that you can in your control. Now, if you've had a grade 2, 3, or 4 tear, often women, we feel guilt, like, what did I do wrong? And understand that mom guilt is not healthy, but it is real. I struggle with it myself, but understand that we have to go into delivery with a lot of flexibility because we can't control everything. But if we go into it preparing as much as we can with as much knowledge as possible, that's going to be helpful. Please reach out to me if you want to consult with me or even discuss something. I offer free consultation because, again, women, we're walking through this journey, and I don't want you to feel alone, feel guilty, or feel frustrated by it. I want you to live in freedom. That's why One Simple Step is here.